Evidence-based guidelines, very similar to checklists that we've already discussed. Being an evidence-based organization significantly contributes to improving the quality and reliability of patient care. However, with growing health systems, this goal is becoming more challenging. The advisory board released an infographic in 2013 called "Are You Leading an Evidence-Based Organization?" Based on the publication by Hope Kennefic, Improving Physician Adherence to Clinical Practice Guidelines, published in the Cambridge New England Healthcare Institute in 2008, and an executive survey performed by the Physician Executive Council in 2013. This infographic examines the common pitfalls to leading an evidence-based organization, including duplicated evidence-based practice work across sites and facilities, effective evidence-based practice pilots not scaled system-wide, guidelines updated infrequently, missing input from nursing, pharmacy, and behavioral health, physicians receiving insufficient data on their own adherence to clinical guidelines, and revisions creating practice inconsistencies across groups and sites. Clearly a scalability issue and a data reporting issue. Resources are tight. We're trying to reduce the cost of healthcare. Yet, in order to do that, we have to have data, we have to collect data, we have to provide the right guidelines and the right technology to clinicians. And this speaks volumes to providing that when they need it and being able to empower them to impact that process and create a consistent process across a large health system. So that infographic did include some major action items. So based on these pitfalls, how can organizations do this better? One is using a standard process to efficiently gather, assess, and incorporate stakeholder input. Empowering clinicians to drive the quality improvement. Frequent reporting. Physicians are asking them to follow these guidelines, but then they're not getting information back. They're not seeing any data that's collected. They're not seeing any analytics on how it's improving outcomes. And tracking patterns of guideline opt-out and using results to improve guideline quality. So there's the continuous improvement. If you're not able to look at when guidelines aren't used, there's no way to improve that percentage of time that they are used. The right technology can solve these problems.